Okay, good afternoon again. My name is Aya Gunny, and welcome to the 2026 Pre-Rulemaking Webinar, Submission Impossible, Not with CMS Merit. We have 4 presenters today who will introduce themselves as we turn over to them, so we can move on to the next slide. Okay, so a few housekeeping notes. Just note that all audio lines will be muted during the presentation. This meeting is being recorded and it will be uploaded to the Pre-Rulemaking Resources webpage that can be found on the MMS Hub for future viewing. And we will have an opportunity to address questions later in the presentation. Next slide. And if you're wondering how to ask questions, if you look at the top of your screen, you will see the Q&A button. When you click that button, it will open up that Q&A function where you can type in your question in the Ask a Question field. And then once your question has been inputted, just hit that Ask button and we will field your questions later on in the presentation. Next slide. Okay, so I'll quickly go through our agenda for today. So we're going to start with a pre-rulemaking overview, and then we're going to go over updates to CMS Merit. So we'll talk about what is CMS Merit. We'll describe the features of Merit. We'll discuss updates to Merit for 2026. We'll provide guidance on completing required fields as well as ECQM requirements clarification. We'll also talk about primer or pre-rulemaking measure review, and then we'll go over some support and resources toward that pre-rulemaking making webpage on the MMS Hub, and then we will get into our Q&A segment. So with that, I will hand it over to Mel Gross to get us started.
Thank you so much. Hello, everyone. My name is Melissa Gross, and I am the CMS task lead for all things pre-rulemaking here at CMS. So we're going to go over a general overview of what pre-rulemaking is, some important timelines, some trends across previous years for the measures under consideration list, and then key considerations for submitters to really think about when you are getting prepared to submit a measure. Next slide. So the pre-rulemaking process is a statutorily required process. So basically, this section of 3014 of the Patient Protection and Affordable Care Act of 2010, or what we call the ACA, created a section, and it's the 1890A of the Social Security Act. It requires the U.S. Department of Health and Human Services to establish a federal pre-rulemaking process for the selection of quality and efficiency measures for use by HHS. Below that, we just wanted to highlight some key points in the pre-rulemaking process and to also recognize that it's separate from rulemaking. So in the beginning, we start with the candidate measure submissions being submitted through CMS Merit, that online tool. After that, the next major highlight is that this list gets published. And as it's statutorily required, it's ideally no later than December 1 each year. This allows for that list of measures to move forward to the pre-rulemaking measure review or primer process. And it's where multi-interested groups provide recommendations to HHS through a review of all of those measures, and then that recommendation list is provided back to HHS no later than February 1. After this, there is rulemaking that happens. If a measure is selected by CMS or HHS, those measures will be published in either the proposed and then final rules in the Federal Register. Next slide. This is a list of our pre-rulemaking programs, and it covers a wide variety of settings. So it goes all the way from ambulatory surgical centers to skilled nursing facilities, and it covers hospital settings, post-acute care and long-term care settings, as well as clinician settings. So I'll just give you a moment just to look over that slide to see all the programs, and there's 20. Next slide. So we wanted to highlight the entirety of the pre-rulemaking timeline. So for 2026, if you look to the left of your screen, it starts where we shared the data template for merit, and that's basically the outline of a measure submission. We like to supply that to all submitters so that they have the materials and knowledge of what needs to be submitted. And you can use that as a guide. So we shared that in February. We're now in March. Merit is now open. It opened as of March 19th. During this time, and until Merit closes on May 7th, we hold webinars like this one today in order to provide education and outreach to anyone who might be interested in this process or submitting a measure to CMS. If you continue to move down the line, after Merit closes on May 7th, that is when the CMS quality and value-based programs review those candidate measures and basically make a decision on or a recommendation on if they think that the measure should be incorporated into their program at some point or continue the consideration process for their program. By August, we have now come to the point where we develop the draft MUC list, and that goes through a continued review for the next few months, going through review by CMS, HHS, and the Executive Office of the President before it can be published on December 1. And then after that, like we had mentioned before, we go into the process of the pre-rulemaking measure review committee members providing feedback and recommendations on those measures to HHS, and those are due back to us by February 1. So it's a year-long process, and as we're closing out one cycle, we're getting ready to start the next year's cycle. Next slide. So again, we just wanted to, really highlight the important dates. So we've provided the CMS data template, which will help submitters identify with the fields that are associated with the submission this year and any changes or updates. March 19th is when we opened Merit for measure submissions. Today, we're holding our pre-rulemaking webinar. May 7th, CMS Merit will close for measure submissions, and that's when CMS will take that information and review those measure submissions. And by December 1, we hope to have that list published. Next slide. So some key submission considerations to think about. Measures currently used in a CMS program do not need to go through the pre-rulemaking process or the MUC list again, except under certain circumstances. Say, for example, a measure is being expanded into other CMS programs, or a measure is currently used in a program, but it's undergoing substantive changes, and therefore it would need to be reconsidered. Measure specifications may change over time. If your measure has substantively changed, you should submit it again for consideration. And I do want to point out that while we have examples of substantive changes here, and this is not the exhaustive list of changes. And so what we really want you to do is when you go in to Merit, describe the changes so that we can better understand what changes have been made to that measure. But some examples of substantive changes are the intent of the measure changes, the data source or the level of analysis changes, or it's being considered for a different facility or setting. Next slide. So some other considerations for measure selection is to determine whether a measure is suitable for inclusion on the MUC list. CMS programs often review each submission against these considerations. Does the submission align with or fill an identified gap in a meaningful measures priority or healthcare priority or a national healthcare priority? Is the submission a digital measure or an outcome measure? Those are both highly valued measures. Has the measure been reviewed by the consensus-based entity for endorsement? Does the measure improve upon or enhance any existing measures in the public or private sector? If so, could the original measure be removed? Is the measure evidence-based? Would the measure be burdensome to operationalize? And also, finally, what is the measure stage of development? Is it fully tested, fully developed? That is our ideal measure submission. Next slide. This is just a graphic to show you the stages of development. And what we are looking for is a fully conceptualized, specified, and tested measure to be submitted into the merit system. Next slide. Over the years, we have seen a decrease in the measures under consideration list. So you can see here that in the very beginning of this process, many measures were submitted and added to the MUC list, but it has since decreased significantly. And over the last few years, it's ranged from anywhere from 24 measures last year to 40 or 50 in the few years prior. And then we also, on the MMS Hub, have a complete repository of historical MUC lists and reports that you can find just for historical information. Next slide. We have a report that we publish to help submitters identify what CMS needs may be current or, appropriate for the cycle. So CMS annually publishes a quality measurement needs and priorities report, and the report includes a high-level overview of each program that participates in the pre-rulemaking process. And CMS really does encourage developers to align submissions with those needs that are in those reports when proposing measures for the MUC list. The 2026 MUC list CMS Quality Measurement Needs and Priorities Report is available on that CMS MMS Hub under pre-rulemaking resources. Next slide. So as we mentioned before, we have two initiatives that help guide our organization of our measures and our measure profile. The two initiatives are the Meaningful Measures 2.0 and the Cascade of Meaningful Measures framework. They drive innovation and modernization in quality measurement across programs, settings, and interested parties. These initiatives strengthen the measurement system by closing gaps, reducing burden, and improving efficiency through the use of high-value measures, aligning measures across our programs and our partners, prioritizing outcome-based measures and patient-reported data, advancing fully digital or all-payer measures, and expanding wellness and prevention measurement. Over to the right of this slide, you'll see the meaningful measure, healthcare priorities. We have person-centered care, safety, chronic conditions, seamless care coordination, closing gaps of care, affordability and efficiency, wellness and prevention, and behavioral health. Next slide. We also want to align to Making America Healthy Again, or MAHA priorities. So those priorities are disease prevention at the levels of the primary, secondary, and tertiary prevention, chronic illness management, physical fitness, nutrition, and wellness. Next slide. Next, we're going to discuss the updates to CMS Merit this year. And I will pass it off to Jake Webb. Thank you.
Thanks, Mel. And hello, everyone. As Mel mentioned, my name is Jake Webb, and I am the Measured Management System Pre-Rulemaking Task Lead. In this section, I'm going to provide an overview of what CMS MERIT is and highlight the updates made to this year's tool. So what is CMS MERIT? CMS MERIT stands for the Centers for Medicare and Medicaid Services MUC Entry Review Tool. This is the tool that measure developers and stewards use to submit their clinical quality and efficiency measures for consideration on the Measures Under Consideration or MUC list. CMS MERIT is more than just a submission tool. It also serves as a repository for all submitted measures. Users with a CMS MERIT account can log in and view previously submitted candidate measures by year. This is a useful tool for several reasons. For example, if you want to review historical trends in which measures have been accepted over time, the repository provides easy access. Additionally, if you are submitting a measure in the past that was maybe rejected, but over the last year you've made some refinements to the measure, or maybe it was accepted in the past, but it's now undergoing some of those substantive changes that Mel mentioned earlier, and now you're going to want to resubmit it, the repository allows you to pull forward your previous submission, and then you can update the content, add in new information, and complete any new questions, helping streamline and speed up that submission process. CMS also uses the same tool to review submissions, keeping both the submission and review in one location. If programs have questions during their review, they'll reach out directly through the tool to the submitter. For the 2026 cycle, CMS MERIT opened, as Mel mentioned, on March 19th. It will close on Thursday, May 7th, 2026 at 8 p.m. Eastern Time. After that time, no more submissions will be accepted. If you haven't already, please set a reminder to ensure that your submission is on time. Our team is going to be available for questions all the way up until that 8 p.m. close date. We do strongly encourage that submitters try to upload their measures at least a day or two early to allow time to resolve any technical issues that may arise. If you're new to CMS MERIT, here are several key features that improve the efficiency and effectiveness of submissions and reviews. So prior to submitting your measure, you will be prompted to run a completeness check. This check helps to ensure that all required fields are addressed and flags areas needing attention. You will not be able to submit your measure until all flagged areas have been addressed. The CMS MERIT tool also allows submitters to save their progress and return later. This is helpful if you are only able to maybe give a little bit of time here or there in between meetings, rather than trying to do everything all in one sitting. Something new to 2026 is the autosave feature. So this is something we've heard a lot from submitters in the past, but we have added an autosave, which will reduce data loss risks if users forget to manually save their information before a timeout. We are currently working to finalize this enhancement, and it should be coming in the following days. So once that is active, you will see a banner on that CMS MERIT login page letting you know that autosave will be a new feature to use. We want this tool to also be as transparent as we can to the submitters as to where their measure is in the process. Once the measure is submitted, users can see their submission status as it goes through the different levels. So once you're submitted, it'll go through an MMS quality check where we'll kind of just make sure that everything is submitted, everything is logical, and that there's no major flags that we need to address before programs. Once MMS does their quality check, the CMS programs will begin their review, and then ultimately the MUC List decisions will be released. Once a MUC List decision is made in the tool, those submitters can then go in and also view reviewer comments, especially if a measure is not accepted, to kind of see what that rationale was. Annually, we do work with our human-centered design team to ensure that CMS MERIT tool is as user-friendly and easy to navigate to improve usability. And one of those ways that we've improved this year is with the copy and paste functionality. The copy and paste functionality itself is not a new feature. But what is new to 2026 is that we now have different ways of formatting within the tool. So you can now, bold, italicize, underline, add bullet points. You can even do tables within a free text field. So not only can you copy and paste those over, but you can also, if you're manually typing, be able to put in those different formats to be able to describe your information the way you'd like it to be. And then finally, submitters are able to export a PDF of the full submission for records, or if you have deliverables that you need to show, that would be available once you submit your measure. So here is a deeper look at several enhanced features and updates for the 2026 cycle. If you were familiar with last year's submissions, survey-based measures are now referred to as instrument-derived measures, which better captures measures relying on any validated instrument, such as surveys, assessments, etc. We have also improved the skip logic in CMS Merit to enhance the submission experience and reduce unnecessary fields. An example being, if you do identify your measure as an instrument-derived, CMS Merit will now ask whether it is a single measure or a multiple measure from the same instrument. Depending on how you answer, there may be additional tabs that appear when relevant. So for example, if you have a single measure for a same instrument, so just one measure for one instrument, you would fill it out, quote unquote, like a traditional measure. If you have multiple measures on the same instrument, you would be able to kind of treat it like a composite measure where you'd be able to put those multiple measures in one submission. If you do want to understand the skip logic used in CMS Merit a little bit more, the CMS Merit data template, which is available on the CMS Merit login page, does help to detail that skip logic for each applicable field and helps to outline which fields are required based on your selection. So if you haven't seen the data template, I highly encourage you because it'll kind of help show you based off of your measure and what you're submitting, what you would need to fill out and what would be required. We also updated a field label. The previous field label was empiric validity interpretation of results. We went ahead and updated it to empiric validity hypothesis affirmation because we wanted to help better reflect the requirement to state whether the statistical results affirm the hypothesized relationship. And we felt that the change in title of the field label kind of helped make that a little bit easier and show what we are looking for in that question. And then, as I mentioned previously, the new autosave feature, again, is going to help with that prevention of data loss. Another major change that we got based on submitter feedback involves the submitter comments section. Previously, submitters could only provide additional comments in one single final tab. Say that there was a field that you could only put like a checkbox, but you really felt that you wanted to provide some additional important information to the reviewers. You were then able to use that submitter comment box and add in that additional information. However, if there was multiple areas that you wanted to provide additional information, you had to fit it all into that one box. To improve clarity, Merit now will include section-specific comment fields. So for example, as you can see in the image, in the steward or owner section, there is now a field labeled submitter comments for the steward or owner section. There's going to be similar fields now that appear in the properties, characteristics, and similar measure tabs. We are still going to keep the general comments section at the bottom. So if there is information that was not covered at all in the submission that you still would like to share, you are still able to share that information. So these are some new fields that were added to the cycle. The first one is a question on whether submitters have permission to submit a measure when they are not the steward or owner. We have also added new questions specific to the fire enablement, including whether the measure is currently fire enabled or will it be by the end of the year. I'm not going to spend much more time on the fire, as you're going to hear shortly in the webinar about more of the fire enablement and the new guidance around this. The next question you're going to see is specific to measures that have identified that they are undergoing that substantive change. This is going to have a question that allows you to be able to list and describe that substantive change or changes. This is going to help both the reviewers and the primer committees help to understand what specifically has changed since that last submission. We've also added a question asking whether a measure is implemented in any federal programs outside of the pre-rulemaking process. We have always asked specifically if the measure has or is used in any federal programs that use the pre-rulemaking process. But we want to expand that out to include programs outside of pre-rulemaking. Some examples of this include federal demonstration models, pilots, or quality improvement initiatives. This information is going to help paint a more full picture of the measure and its capabilities to the CMS programs reviewing their submission. Something that is also not listed here that I thought would be really good to share is another question regarding the consensus-based entity or CBE endorsement process. If your measure was submitted for CBE endorsement and has an endorsement status of endorsed with conditions, CMS Merit now is going to ask submitters to then list those conditions. This is also, again, going to aid in that review process. Not every question in CMS Merit is going to apply to every submitter or measure. Some fields are highly specific. For example, you're not going to need to list conditions if your measure was just endorsed or has never been submitted before. Similarly, you are going to submit, if you're submitting a brand new measure, the questions related to substantive change are not going to apply. There are going to be some questions that, regardless of if it's been through endorsement or new or old, you're going to have these questions. And this includes like the fire enablement. Every measure is going to have to answer that. If you have permission to the measure steward or owner, and then if it's been submitted to a federal program outside the pre-rulemaking process. So while new questions have been added this year, not all of them are going to be relevant to every user or every submission. If your measure is accepted to the MUC list, it will undergo the pre-rulemaking measure review or the primer process. To help support accurate and consistent evaluation, developers are encouraged but not required to attach decile and importance tables. You're going to add these to the documents on the attachment tab, just like you would any other attachments. And the thought of this is, if these documents are not provided, the primer staff is going to have to calculate them independently. So including these documents in your submission is going to help improve that transparency and supports more informed committee deliberation. So again, as I highlighted, it is not a requirement, but it is highly encouraged. So you would just add those as an attachment as you would any other required attachments for your measure. Based on feedback from the 2025 merit cycle, we are implementing a standardized citation formatting throughout the CMS Merit submission process. The standardization will help to ensure consistency across submissions and support a cleaner, more efficient review process. So beginning with the 2026 cycle, all citations should use AMA-styled bracketed numeric citations in the order that they appear. Please include a reference list at the end of each of the sections, formatted using those AMA guidelines with DOIs and URLs when available. Some areas where citations should be included are things such as the rationale fields, clinical guidelines, and any other fields relying on external evidence, data sources, or literature. If a submission has a field that has citations but not in AMA format, or there's a field that should have citations but it does not, we will, as the MMS team, will work with the submitter to update that section to be appropriate prior to the CMS program review. And then finally, this requirement is not new for 2026, but does remain critically important. CMS does require that all testing materials and documents submitted through Merit be Section 508 compliant, ensuring digital accessibility for individuals with disabilities. Attachments are made public to enhance transparency, so accessibility ensures reviewers and primer committees have full access. documents meet federal accessibility standards, and any non-compliant documents must be remediated jointly by MMS and the submitter before the MUC list is finalized. So again, very similar to the citations above, we as MMS will work with the submitter to get those updated and appropriate in a certain time frame. And with that, I'm going to turn it over to Dr. Joel Andrus of CMS, who's going to discuss the ECQMs and DQMs.
Thank you, Jake. Good afternoon, everyone. My name is Joel Andrus, and I'm the ECQM and Digital Quality Measure Program Lead at CCSQ here at CMS. Everything that you've just heard about the submission process for the MUC list is relevant to the ECQMs and DQMs, but because they're standards-based quality measures, they have a little bit extra that you're going to need to navigate through the process if you're planning on submitting them to the CMS program. Next slide, please. So the first step in providing this is the measure specification. Currently, we require authoring of these measures through MADI, the Measure Authoring Development Integrated Environment, which is a CMS owned tool that supports both the authoring and testing of ECQMs and digital quality measures as a means to provide documentation for them for the implementation in other systems. You are also required, in addition to authoring the human readable files that allow for consideration of the measure specifications, you're also required to provide a MADI test case export, which demonstrates that the measure logic is 100% passing and provides testing coverage of all of the measure logic applied within the documentation. You're also required to publish within the Value Set Authority Center, or VSAC, any value sets that are relevant to that are required for the implementation of the measure. These may include value sets that already exist within VSAC, or entirely new value sets that you've developed in order to support the measure. For digital quality measures, these same requirements are in place. We also expect that we'll be providing many test cases as part of the measure specifications, that they will achieve 100% passing and 100% coverage. We'll note that when you're applying the QDM-based measure specifications, you're applying the standards that are required in CMS programs under the certified IT program at ASTP ONC. Under the fire specifications, however, we're asking that you submit these under the applicable standards that are currently in place, which include Fire QI Core 4.1.1, although we prefer the more advanced version, QI Core Stu 6, and incorporate that within the documentation of the measure as it's authored. Next slide, please. Thank you. For 2026 merit submissions, we're very much preferring that you submit the measures in the fire standard. However, you will still be allowed to submit the measures using QDM, the quality data model. Starting in 2027, however, next year, we'll be requiring that fire specifications be submitted for our digital quality measures and ECQMs. You will still be allowed to submit QDM specifications, but they must be accompanied with fire specifications as well. And as you can see here, we anticipate in 2029 and going up and moving on from there, we'll be discontinuing consideration of QDM measure specifications for ECQMs and digital quality measures, and we'll be requiring only the fire measure specifications for future merit submissions in 2029 and beyond. Next slide, please. Thank you. As with as I mentioned before, the measures must meet the reliability and validity testing requirements that were provided earlier in the discussion by Jake. Feasibility testing must also be documented on the feasibility scorecard to ensure that the underlying data elements that are part of the measure are feasible to collect under within certified EHRs. Next slide, please. Thank you. When you submit a measure to CMS for consideration under the ECQM and DQM heading, there are a number of expectations in place that for measure stewards to maintain the deployment of those measures within our programs. And these are in place because the standards-based measures have to be continuously updated, consistent with the evolving standards out of HL7. And so we have a number of requirements or expectations built around that need. First and foremost, you're expected to understand and apply QDM and FHIR-based standards to the measure where appropriate. Includes use of the quality data model and quality improvements or QI core FHIR profile data model standards. It also includes use of CQL measure logic standards, which is what MADI currently supports for measure logic. Use of the CQL-based HQMF and FHIR measure resources, based measure definition standard. It also requires the understanding of the quality reporting data architecture, QRDA 1 and 3, and the data exchange for quality measures, individual and summary standards, with regard to the FHIR measures for data exchange. We will expect that you are able to make and test technical changes using the tools that we've provided for implementation measures, including MADI and the VSAC. There's also an expectation that you will support responses to stakeholders' questions that CMS receives through its JIRA system, and that we then turf to measure stewards to ensure a timely and prompt response to stakeholder questions. Next slide, please. Thank you. The measure steward is also expected to participate in the ECQM and digital quality measure annual update process, which is distinct from update cycles for other measure collection types and may begin at a different time than those for those other collection types. Measure stewards are expected to adhere to the timelines and processes set forth by the ECQM and DQM annual updates for both FHIR-based digital quality measures and QDM-based ECQM specifications as they're applicable. CMS does provide technical assistance through its own contractors to ensure that vendors are able to make use of the tools and provide timely updates through the annual update process and to support stewards as they're going through the process. Stewards are also expected to maintain documents that are used to support measure updates, including technical release notes and measure flows, or others as they may become necessary. Next slide, please. As part of CMS's transition to digital quality measures, we're planning to use the HL7 FHIR data model and FHIR reporting requirements for the representation and reporting of digital quality measure data. Beginning in 2026, measure stewards will be expected to support maintenance of the FHIR-based DQMs as well as any submitted QDM-based ECQMs. If stewards submit only a QDM-based specification, CMS will work with them to convert their specs to the FHIR standard through the annual update process. So it's important to note that even if you're submitting the measure currently in a QDM and under the quality data model, we're moving to transition our existing QDM measures to FHIR regardless. So that will be an expectation for the future that you should be aware of. Here on the slide, we've provided a number of links to resources that will help you to identify that will help you to see the data standards supported under HL7, the tools that support our measure authoring and maintenance, including MADI and the VSAC. We'll also give you access to the ECQI Resource Center, which is where we house the measure specifications once they've been authored and published within the annual update. Next slide. And now I'll hand it off so you can discuss the pre-rulemaking measure review. Thank you.
Thanks so much, Joel. Hi, I am Kate Buchanan, the Deputy Task Lead for the Pre-Rulemaking Measure Review process, also known as PRIMER, that I'm going to talk about for the next couple of minutes. Next slide. So here you can see the pre-rulemaking graphic again. The last box within kind of the red outline before you get into rulemaking is PRIMER. And this is where we at Battelle convene interested parties from various backgrounds that are impacted by measures that CMS uses in its quality programs to get together and, in accordance with statute, provide recommendations to HHS for measures for consideration no later than February 1st of each year. Next slide. I'm going to discuss some highlights from the guidebook relevant to you all as developers and stewards in the next couple of slides, but there is a full rundown of our processes within the guidebook that will be linked in the chat. I do want to note that we update our guidebook annually, so you should expect to see a public comment opportunity on proposed updates to the guidebook this summer. Next slide. So our PRIMER process has three major phases. The first is information collection. And this is where we create preliminary assessments on each measure on the MUC list. Battelle staff create PAs using multiple data sources, but the most important is the CMS MERIT submission form. This is our source of truth, and the more thorough the submission, the more comprehensive we can be in our PA. We also have discussions with measure stewards and developers and reference the PQM submission tool and repository database as needed. The PA evaluates whether a measure meets criteria related to the importance, reliability, validity, feasibility, and usability in the context of its specific intended use. This allows the committee members to focus its review on the PRIMER goals, which is to assess if the measure is appropriate for a specific program rather than engaging in discussions on that would be better suited for the endorsement and maintenance process. The second stage is analysis and feedback. And during this period, written public comment opens and committee members complete pre-meeting initial evaluation forms, which we have shortened to PI forms, on the measures on which they are assigned. The third and final phase is discussion and recommendation. Battelle synthesizes the PAs, PI form results, and public comments, and rolls it into the PRIMER recommendations meetings, where the committees make recommendations to CMS on measures they are considering for use in certain quality programs. These are just recommendations, and while they are important information for CMS to consider, CMS itself ultimately makes the final decision. Next slide. So now as a developer and steward, what is your role in the PRIMER process? I've mentioned a couple of things, but now let's really get into it. I do want to note a caveat, though, is that activities and timelines are subject to change based on guidebook revisions and the MUC List publication timing. Again, the updated guidebook will be available for public comment on the PQM website in the beginning of June. By August and September, developers and stewards will make sure that all measure testing data is accurate, current, and complete. This ensures that we develop PAs for committees that have access to the most complete data for them to review. In October, we at Battelle host a developer steward education meeting, which is where we're going to review the PRIMER process, evaluation, and key milestones This is really where we are able to engage with you on what you should expect, clarifying again this developer-steward relationship and to these meetings, expectations around participation and the like. In mid-December, there is a primer measure previews for the setting-specific workgroups. And this is where committee members can ask CMS and developers and stewards clarifying questions, which will inform their reviews. So this is set to occur while committee members are completing their PI forms, and allows for a clarification. If there's some misunderstandings about the measure, they will come out during this. So it's a very important meeting to participate in. It really helps prep the committees as they move forward to the grand finale, which is the primer recommendations meeting. And that is where the advisory group and recommendation group meet to discuss the measures. The recommendation group is the only group that actually votes, but the advisory group is also in attendance and will provide some key considerations they think that the recommendation group should keep in mind as they move forward. As with the primer measure preview meetings, CMS may ask developers and stewards to respond to committee questions. So it's incredibly important that in addition to the primer measure preview, that you're able to attend the recommendation group meetings. And with that, I will turn it over to you, Jake.
Great, thank you so much. Before we open up to Q&A, I just wanted to take a couple minutes just to kind of talk about some resources, some support. I know we've talked throughout the presentation today. You've probably seen the discussions of the links and resources being shared in that tab. So I just kind of wanted to kind of highlight everything again, kind of show you if you need more resources, where to kind of go to, where to point at. I will also mention all those links that we are sharing in that discussion chat. We will also include in the QA summary that we do following the event. So when we list out all the Q&A and the answers, we'll also include those resources. But all those resources are available either on the MERIT tool itself or the MMS Hub. So the first thing I just wanted to highlight is the quick start guide and the MERIT data template. Those are both available on the Hub's login page. The quick start guide is going to be really, really helpful, especially if you're new to MERIT, this is your first time. It has the step-by-step instructions on how to create an account, how to set up your two-factor authentication. Even if you have used MERIT in the past and you just kind of want a refresher, it'll kind of show you again how to submit a measure. If you are one of those submitters who have submitted in the past and would like to use that past candidate measure repository to pull your measure forward, it'll show you step-by-step how to do that as well. And then again, the data template we've talked about, just, it's a Word document, it has all the questions, it's got the skip logic. It's a really great resource and tool that we like to recommend, especially if you would like to collaborate within your group. You can share a Word document with all your group, have everybody fill it out, and then use that data template to then give to someone for them to put into the MERIT tool. We also just want to highlight our email for support, so the mmssupport@battelle.org. Again, if you have any questions, if you have trouble with the tool itself, if you just maybe have a question on how to submit an answer or how to answer a question, you can definitely forward it to us. We can get the correct information or get you to the right person to be able to answer that, and we'll be able to forward that information to you. As I mentioned, we do have on the MMS Hub, we have a pre-rulemaking webpage. So this webpage really highlights a lot of the things that Mel talked about earlier with kind of the whole process, the timeline. Why do we have a pre-rulemaking process in general? This webpage also has 2026 guidance. So whenever new things come out, so when new documents come out, such as the MIPS peer-reviewed journal articles, those are all housed there. That's a really good spot if you just need to look at one location to kind of see what's new. Once we get a little bit closer to MERIT closing, we're going to highlight there that MERIT closes on May 7th. We're going to really highlight to make sure everybody knows that timeline. This is also where you're going to find that repository of all the MUC lists as well in the recommendations. So if you have not seen the pre-rulemaking webpage, I highly do encourage you to go on there. It's pretty easy to get to. There's a link in the chat, but also just on the MMS Hub, if you go to Measure Implementation, you will see that pre-rulemaking tab. With that, I want to make sure that we have enough time for Q&A, so I'm going to pass it over to Aya for the Q&A section.
Wonderful. Thank you so much. Thank you to all our presenters for a really informative session. If we could just go to the next slide quickly, I just want to remind everyone that tomorrow at 2 p.m. we'll be holding an MMS information session featuring the American Heart Association's Get With the Guidelines. So please visit the MMS Hub to register today. Thank you again, and please feel free to reach out to us at mmssupport@patel.org with any questions. Thank you again for joining. Have a great rest of the day.